Now that we completed our interview, I'm going to go ahead and perform my complete assessment for head, eyes, ears, and nose and throat. Um, First, I'm going to wash my hands. I'm going to don my gloves. And I'm also going to make sure that I'm going to ask the patients, can you tell me your name and your date of birth?
My name is Annie Hernandez, and my date of birth is 12/25/1996.
All right. And I'm also going to um, go ahead and make sure that the bed is down and the side rest is up, the call light is in place within reach, and also I'm going to give the patient some privacy, cover the areas that it's not to be examined, and I'm going to note and document the position of the patients and the is she awake, is she alert, and any orientation. So now we're going to do the skin assessment. I'm looking for overall the skin assessment, the face. There is no edema, and the whole body. There's no edema, there's no swelling, there is no redness, no lesions, and there is no mass, any unusual abnormal moles. I am checking for the skin turgor is elastic. There is no signs of dehydrations. Skin is warm to touch. Capillary lipple is less than 3 seconds. Pulses are all palpable, and I did not notice anything that is abnormal with the skin. The shape is round, and there is no skin dryness, no ticks, no pimples, and overall is a good skin assessment. I'm looking at the scalp and there's no lesions, there's no scalp dryness, there is no tenderness, any lesions, any lice, there is no tenderness. The texture of the hair is full and long, and there is no it's shiny, smooth, and smooth. I will inspect the nails. It's round, it's pink, there's no brittle, there's no any unusual drainage, any breakdown, and capillary lipper is less than 3 seconds. Its pulses are palpable, and also I'm going to check the feet circulation later. I'm assessing for the face of my patients. The face is symmetrical. There is no involuntary movement. Uh, the skin is soft, smooth, no lesions, no abrasions. I am going to check for palpate the skin, the maxillary mastoid, bilateral. There's no tenderness, there's no pain, there's no swelling. And do you feel anything here?
No.
There is no swelling on the frontal sinuses. I'm going to check for functions of TMJ. Can you do this for me? There's no popping, there's no pain, there's no tenderness. It's symmetrical, the face is symmetrical. So I'm now examining her eyes. The eyes is equal in size, it's round. She has a brown iris, sclera is white, conjunctiva is pink, and the lashes is intact. There is no lesion, there is no edema, there is no drainage. Lacrimal canal is intact and there is no drainage. She's able to move up and down on her eyes without difficulty. Her eyebrows are intact. Can you do this for me? Able to move and up and down, and the shape of the eyes is round and the color is brown. I'm examining her eyes now. I am looking for follow this dystopian light for me. and I'm doing an extraocular movement and up and down, and there is no, the pupils is perla, brisk, equal 2 centimeter. There is good, there's no extraocular movement. Can you look at this one for me? Eyes accommodate with the accommodation. Looking for the ears, the external part of the ears. The ears is intact, good inside, no tenderness, no lesions, no pain, no drainage, no discharge. Skin is pink, ears are bilateral symmetrical. Now I'm looking for the inside of the ears. I'm looking for the ear canal is intact, no drainage, no lesions, the no tenderness, no discharge. The tympanic membrane is grayish white in color. It's intact, no abrasion, no retractions. Let me go ahead. I pull back and up, and I can see that there is the same thing. There is no drainage, there's no discharge, there's no lesion, pink in colors, there's no swelling. Tympanic membrane is intact, no bulging, no not retractions, well, gray and fair color. I'm going to check for hearing, and I want you to cover your ears. I want you to repeat what I say.
Hello, Annie.
And hearing is intact. Now I'm examining the nose. It's no tenderness. It's aligned on the face. There is no visual mass. There's no lesion. There's no discharge. If I can see, I'm going to look at inside. And inside the nose there's no abrasion. The septum is intact. There's no discharge. It's pink in color. I'm going to do another one on the other side. The same thing. There's no lesions. There's no tenderness. There is no pain. There is no discharge and abrasions or lesions. Okay, I'm looking at the lips. The lips are intact. It's moist and pink. No redness, no swelling, no lesions. Now I'm going to have you open your mouth. I'm looking at the teeth. The teeth is intact. There's 33 teeth. No, the mouth is no lesions, pink, moist. There is no. Can you stick up your tongue for me? The tongue is, there's no lesion. There's no mass. It's red in color. The vein is. I can see the vein. It's intact. Okay, go ahead and say ah. The uvula is rising up and down. It's red. The tonsils are enlarged and has white patches on it. The palate is intact. There is no lesion. There is no abrasions. No abnormalities noted. And there is no pus. And that's all. It covers our head. Can you repeat the following words? Light, tight, dynamite.
Light, tight, dynamite.
The speech is intact. There is no slurry speech. There's no abnormality. And that's complete our head, eyes, ears, and nose and throat assessment. Thank you very much.